Hello, my name is Katie. I am a neonatal nurse practitioner student and I'm going to be doing a well baby exam on this infant today. I'm going to begin by gathering my equipment. I have an ophthalmoscope, I have a stethoscope, and I'm going to begin by performing hand hygiene. So this infant today is 38 weeks old, was born 6 hours ago to a 40-year-old mother who is gravida 2, now para 1. He was born via vaginal delivery. He is well appearing, is pink in color with some mild acrocyanosis noted on his peripheral extremities. He is well hydrated and has been reported to have breastfed twice already. He is in an active, quiet, alert state, but his eyes are open. He is exhibiting isotonic and symmetric movements throughout his body, and there are no apparent gross deformities upon initial inspection. And he is exhibiting no signs of distress at this moment in time. This infant is pink. Like I said before, has some mild acrocyanosis in the extremities, which is a common finding being 6 hours old. Skin is warm and intact. I'm going to turn the infant over as well. Inspect the back and the skin back here. It's smooth. There are no apparent rashes. He does have some mild edema. There is some edema on the scalp too, probably from the vaginal delivery. His skin has good turgor. There's no loose or hanging folds, which is a sign of good hydration. He does have some vernix still on him from the delivery, and no lanugo is noted. Additionally, he does have a Mongolian spot on his back. When assessing the head, ears, eyes, nose, and throat, I'm going to begin with the head. This infant does have some molding. There might even be a cephalohematoma present from the vaginal delivery. The head is symmetric, has midline symmetry noted, does have some edema back here as well. From the chart, it was noted that the head circumference is 34 centimeters, which is appropriate for a term infant that's 38 weeks old. The sutures are not overriding, they're palpable, less than 1 centimeter apart. The fontanelles are soft and flat. The anterior fontanelle is approximately 2 centimeters, and the posterior fontanelle is approximately 0.5 centimeters, which are appropriate distances and measurements for the fontanelles. Hair distribution on this infant is even throughout the head. It's light brown in color, it's soft. On the head, there are no lesions noted, no masses noted, and like I said, I do believe this infant has a cephalohematoma from birth trauma. His face is symmetric. When he's crying, which he is right now, there's also symmetry noted. When looking at his ears, he's well-formed pinna, and the cartilage easily recoil on both sides once I curl them up, or after I curl them up. His ears are level with the outer canthus of his eye, and auditory canals are present on both sides of his ear. His eyes are open. He does have eyelashes and eyebrows present. His palpebral fissure is normal in length. The sclera of his eyes are white, and the irises are blue. Using the ophthalmoscope, I'm going to perform the red reflex test and look in his eye. The red reflex is present, indicating no signs of eye abnormalities. He also has patent nares with no nasal flaring present and is breathing through his mouth. Looking at his mouth, his lips are pink, his gums are pink, and his tongue is pink, indicating no signs of any kind of distress and good perfusion. I'm going to let him suck on my finger to assess if there's a cleft palate or cleft lip. As he's sucking, he has a good coordinated rhythmic suck, and as I'm palpating in his mouth, there's no cleft palate or cleft lip noted. Looking at his neck, I'm going to turn him over again. There is no webbing noted, and no mass is palpated. In inspecting and observing this infant breathe, he's breathing comfortably at a rate of 50 breaths per minute. He is relaxed and has bilateral symmetry noted during his inhalations and his exhalations. Diaphragmatic respirations are observed. There are no retractions noted. In inspecting for any cardiac abnormalities, I'm going to first begin with looking at the precordium. Given that this infant's only a few hours old, there is a visible precordium noted along the left sternal border. His chest wall is symmetric and smooth. There are no masses noted upon inspection, no atrophy, hypertrophy, no barrel-shaped chesting noted. I'm next going to start my auscultation and listen to his heart and lungs. As I listen to his lungs, I'm going to move in a clockwise fashion from the left to the right and down like a snake through his lung fields. His lungs are equal and bilateral. There's no rhonchi, wheezing, rales, coarse crackles noted. I'm next going to listen to his heart, using both the diaphragm and the bell of the stethoscope. After listening for a full minute, the heart has a regular beat. There are no skip beats. There's no murmur noted. And now I'm finished listening to the heart. I'm going to palpate his clavicles, his breast tissue, sternum, and ribs. Beginning with the clavicles, they're intact. No fractures are noted. There's no crepitus, swelling, or any kind of tenderness present. He does have breast tissue present with no hypertrophy, fissures, secretions, or masses palpated. As I palpate his sternum and ribs, there's no crepitus or masses noted here either. Next, I'm going to move on to his pulses, beginning with his radial, and then his brachial. I'll move from the right side to the left side. And then I'll move down to his pedal pulses. And as I do this too, I'm noting his capillary refill time is approximately 3 seconds, showing good perfusion. His pulses are all +2. No bounding is noted. And the rhythm is regular. After his respiratory and cardiac assessment, I'll move on to the abdomen. And looking at the abdomen, he has a round abdomen. It's symmetric. There's no obvious swellings or depressions. I see a patent and present umbilical cord. As I look at the cord, the clamp is on. It has 3 vessels. I see 2 arteries and 1 vein. The cord is shiny, pearly white, and gelatinous. And now I'm going to listen to his vowel sounds. I'll listen in all 4 quadrants. I was able to hear vowel sounds in all 4 quadrants. I'm next going to palpate for any tenderness or masses. The abdomen is soft and no tenderness or swelling is felt. I'm going to try and assess and palpate for the liver. It's located in the upper abdomen and extends also into the left upper quadrant. I feel the liver edge, which is smooth, firm, and sharp, which are normal findings. Next, I'm going to palpate the spleen, which is located in the left side of the abdomen. And the spleen is normal in size. No enlargement is noted. After assessing his abdomen, I'm going to assess his kidneys. I'm going to begin by palpating both kidneys. They're located in the lower position of the abdomen. I can feel the inferior poles of both kidneys. The right kidney feels a little bit lower than the left. They're equal in size. And they're smooth to touch. Approximate measurements are 4.5 to 5 centimeters in length, which are normal for a term infant. Next, I'm going to inspect his groin and femoral area. The groin is flat. I'm palpating for any kind of hernias. There are no inguinal hernias or bulges seen. Pulses are equal bilaterally, and these testes have descended. While I have him open, I'm going to assess for a patent anus. This infant does have a patent anus. Next, as I've been doing my whole assessment, I've sort of been looking at his musculoskeletal system as I move from head to toe. But now I'm going to do a more in-depth approach and look at his musculoskeletal system. As I've been doing my assessment, I've noted symmetric movement, symmetric alignment, isotonic movement as well. His movement is random and uncoordinated, which is typical of a term newborn infant. There are no swellings or gross deformities noted along his body. His tone is isotonic. On each of his hands, he has 5 fingers, and on each of his toes, or each of his feet, he has 5 toes. Creases are normal on the bottoms of his feet and on the palm of his hands. Difficult to open his fingers. No digital deformities are noted. His fingers are flexed in a fist with thumb under the fingers. Next, I'm going to roll him over and assess for any kind of sacral dimples or abnormalities of his spine. As I roll him over, there are no sacral anomalies or sacral dimples noted. I'm going to sit him up, allow his spine to curve, As his spine is curved, again, no deformities are noted. He has a great curvature. Convex, with no processes or abnormal curves. I'm going to inspect his arms and legs one more time. There are 2 bones noted in the forearm of his right arm, and 2 bones noted and felt in the forearm of his left arm. I'm assessing for range of motion. This infant is able to reach his arms above his head, his feet. He has good range of his knees. I'm going to passively rotate his neck. Turn it for him. I'm flexing and extending his neck. No abnormal movement is noted. Next, I'm going to assess for any kind of hip dysplasia, performing the Ortolani and Barlow movements. So first, doing the Ortolani movement, I'm going to move to the foot of the bed, on the angle here. It's a test of hip reduction. So I am going to flex this infant's knee and hip, grasp the thigh with my thumb positioned along the inner thigh, greater trochanter, and trying to put this hip back into reducing it. No palpable clunks are noted on the right side. I'm going to do the same thing with the left side. As I bend his knee up, if he lets me, trying to reduce his leg back in. And again, no palpable clunks are palpated. Next, I'm going to assess his hips using the Barlow maneuver. This maneuver is to determine if the hips can be dislocated. The knee is brought to center. My thumb will push laterally on the upper inner thigh and try and dislocate the hip. And again, no palpable clunks are noted, indicating this infant does not have hip dysplasia. Next, I'm going to move on to the reflex portion of this exam and assess this infant's reflexes. As I've previously done when I was looking at his mouth, when I was assessing his head, eyes, ears, nose, and throat, I allowed him to suck on my finger. When doing so, this infant demonstrated a good sucking reflex with coordinated movement and strong suck. Next, I'm going to perform the rooting reflex. As I stroke this infant's cheek, he turns his head towards the direction that I stroked. I'm going to assess the other side. And he turned his head that way as well. Moving from the head to toe fashion, I'm going to assess his palmar grasp. I'm going to open his hand up and allow him to hold on to my pinky finger. As I try and withdraw support, let go. There you go. His grasp tightens, demonstrating a palmar reflex or palmar grasp. I'm going to do the same on the other side. Can you open your hand for me? Good job. Okay, he has a grip of my finger. As I withdraw support, his grasp tightens again. Next, I'm going to assess the Babinski reflex. This is done by stroking his feet from heel to toe, and if it demonstrates a positive reflex, his toes will splay open and extend his toes. Okay, I'll begin on the right side. I'm going to stroke upwards. And as I do so, this infant extends his toes, demonstrating a positive Babinski reflex. I'll do the same on the left side. And again, he demonstrates a positive Babinski reflex. Next, I'm going to assess the Morrow reflex. So I'm going to hold the infant slightly above the bed. Okay, I have his back and head supported. As I withdraw my hand in support, oh look, His arms abduct and extend, and his hands open, and he becomes startled, demonstrating a positive moral reflex. Lastly, I'm going to perform and test for the truncal incurvation, or the gallant reflex. So I'm going to turn him over ventrally, supporting him while I do so. And as I stroke up his back, his pelvis turns towards the stimulus, the side of the stimulus, demonstrating a positive gallant reflex. Given that this infant is only 6 hours old, the stepping reflex will not yet be present, so I'm not going to assess for it at this time. Overall, this infant has been cooperative during this exam, crying at times, but has otherwise been active and alert, looking at me as I'm performing this exam. He's exhibited no signs of pain today and seems comfortable as I do my assessment. My overall impressions of this infant are that he's a well-term infant with no abnormal findings at this time.